all of the healthcare workers across the state, across District 1, that goes into New Jersey, Connecticut, together on all issues that affect all of us. There's 15,000 healthcare workers in District 1. And, you know, before the Healthcare Coordinating Council, we'd all fight these issues individually, whether it's safe patient handling, patient ratios, problem contract negotiations. This way we can absolutely work within a network and, you know, always together, then that makes us stronger.
I mean, it's a great teamwork exercise because it shows how ready we are to go into situations and compete rather than collaborate.
Because a team isn't just a bunch of people who've been assigned to a different shift or a unit or a floor. Together, it's a bunch of people who have ways of communicating, ways of sharing knowledge, ways of feeding back issues to each other, and so forth.
According to the Workplace Bullying Institute, 58% of the workplace bully victims are women. Healthcare workers are no more or less subjected to an unhealthy workplace than anybody else. In fact, they probably are more. And so what we want to do with the workplace, the Healthy Workplace Bill, is we want to have employers establish a clear policy that sends a message to everyone that there is a zero tolerance policy for this type of behavior.
You go on strike, you can be permanently replaced.
For economic issues.
For an economic strike. If you go, that's why it's imperative that if you go on strike, it has to be over an unfair labor practice.
A lot of times special interest groups like yourselves, they only care about the little portion of the water that they swim in. If healthcare unions only care about healthcare, you will most certainly be eaten by the sharks. Because in order to make the environment safe for all of us workers, that means we have to, you know, work together and care about issues beyond our special interest.
The law doesn't require the employer to offer family coverage, dependent care.
The issue of safe staffing and staffing ratios is going to be huge as we take in more patients. We're going to have to make sure that we're not taking in more patients than we can provide high quality care to. And so I think it's really of fundamental importance to get safe staffing laws passed so that hospitals will be held to account to make sure that they're giving patients safe care.
Be proactive in terms of speaking to their legislators and getting this bill moved out of committee and into a vote and ultimately to get the governor to sign it off. It worked in California, it definitely can work in New York.
Nursing homes have financial restraints, but you introduce it gradually. What you want to do is get enough equipment, enough of the devices that correspond to the needs of your residents. This bill, I think, is critical both for the employers in healthcare, the employees, and the patients and residents in healthcare, because in New York State, just among employees, the highest rate of injuries we have in the state are among healthcare workers.
We're lifting patients, we're moving patients from chair to chair, sometimes with assist and sometimes without. And at any given moment, a patient could fall or collapse or not be cooperative, and that can jerk our bodies. So again, that risk is very real for receiving a back injury.
I think the biggest thing that I think we did this past year was the activist training. I think that's something to get our members involved, not our reps and that, but our normal members, our stewards. They got trained, they go to Albany, they talk on these issues, and since then we've had this group of people that are now ready to do more things, and I think that's probably the biggest accomplishments we did this year, is get the average member involved and excited.
It is what you wanted, and we hope that you did enjoy.
I thought it's been amazing, very educational.
What we hope you get out of this is a new inspiration, new knowledge, and new friends.
I think this was very informative. stand up and fight back is much more now than a slogan. It's much more now than what are we going to do in our next bargaining fight. It's what we have to take into every community where we live. Some of them are tough communities in this part of New York State. And that we have to realize that it's not where we come from or any of us come from or what we look like or anything else. It's what we stand for. And we stand for economic justice. We stand for democracy. And I know that the healthcare workers in this district will stand up and fight back.
I'm getting sick and tired of talking about all the obstacles we face and all the challenges that we face and how much money that they have to spend, because they've always had money. We know they're going to spend it. But here's the thing, there's a couple of things that we have that they'll never be able to have. They'll never be able to buy. With all the money in the world that they have, those fat wallets that they have, the blank checks that they can write, all the money in the world can't buy our heart. They can't buy our soul. And they can't buy the dedication and the commitment that we have to one another. If we join together, as I said, and stand together and fight together, we win. That's as simple as that. You can't put a price tag on heart. You can't put a price tag on values and principles and ideals. We have it, they don't. We win, they lose if we stand together.
Collective bargaining in this country is under attack. They're trying to get rid of us. They don't like us. They don't like to have the middle class. They're trying to get rid of everyone in this room who has a union card in their pocket, not just public workers, not just Verizon workers, but every person who has a union card in their pocket is under attack and will be under attack until we get back the leverage that we need to make sure that we win those attacks. Are you with me? Yeah! Are you ready to stand up and fight? Are you ready to educate your members so that they understand? It's not just somebody else, it's them. It's every single person who works for a living in this country. There's only one way to do it, and that's get up, stand up, fight back. Are you ready, brothers and sisters, to stand up? Are you ready to fight back? Come on, I can't hear you. Brothers and sisters, if you're ready, we're ready. We will never, ever, ever surrender.
Our 10,000 healthcare members in this area, upstate New York and District 1, matter. And they matter in our union, they matter in the communities where they serve folks and where they live.
Healthcare matters.
Healthcare matters.
And it certainly matters to all CWAers because it's the #1 issue at the bargaining table.
Healthcare matters.
Healthcare does matter.
Healthcare matters.